here for Miss Patricia Green, birthday 2954 with allergies to penicillin. And my order is to place her Foley catheter, and it's prior to her small bowel obstruction surgery. So that's the reason why she's getting it. She's having small bowel obstruction surgery. And we're not being nice to her and putting the Foley in after she's asleep. We're gonna do it while she's awake. So there's my order. So I see that she has allergies to penicillin. So I'm gonna take my order. This is the same order sheet that you guys have been using all along. I'm gonna go to the supply cabinet and I'm gonna grab my Foley catheter. I'm like outside the room right now. Grab my Foley catheter kit. I'm gonna look and see that it's clean, dry, intact, and not expired. And I'm gonna bring my own sterile gloves that I know fit me. And these are clean, dry, intact, and not expired. So now I'm gonna go to the room. Knock, knock, knock. Hi, my name's Rachel. I'm a student nurse with TCC, and I am going to be inserting your Foley catheter today prior to your surgery. I'm gonna get set up here and then we'll get started and I'll answer any questions that you have. I'm gonna don clean gloves, clean my table, and I'm gonna wait for it to dry. And one thing that I didn't grab, I keep forgetting because I don't do this part in real life, but I'll have it sitting out for you. Is the tape of clean, dry, intact, and not expired. Okay, so I am going to provide for patient privacy. And I'm going to take my order sheet. And may I pull down your cover so I can look at your name badge or name tag? Can you tell me your name and birthday? Patricia Green, 2954. Patricia Green, 2954. Can you tell me what you're allergic to? Penicillin. What happens when you take penicillin? I get a rash. Okay, great. Are you allergic to tape, antiseptics like betadine, lubricant, or latex? No. Okay, great. So like I talked about, we are going to put in your Foley catheter prior to surgery, and this is a little tube that gets inserted in your urethra, and it's going to help collect the urine, and it will allow you to have urinary functioning during your surgery and then in that immediate post-operative period. I'm going to go over some other education at the end, but right now, do you have any questions for me? No. All right. Since you're able to walk, here are some wipes. Can you walk into the bathroom and clean your genital areas from front to back? Yes, she's going to get up and go do that. And while you're in bed, are you able to hold your legs up in like a butterfly position, like with your knees open for about 10 minutes? Yes? Okay, great. So I've gone through all of my checkoffs, or not my checkoffs, all of my questions that I need to ask her. Am I doing okay so far? Yes. All right. So I'm going to get everything ready, and I'm going to don a pair of gloves. So I'm going to raise your bed up, and the first thing I'm going to do is I'm going to look at your genital area and inspect, because I want to make sure I know where to go with my catheter. Every woman's different, and sometimes, yeah, move around if you need to move around, Fed. I'm gonna raise my bed up. May I pull your covers all the way down? Yes. You want to make sure that you're raising the bed to waist level, the bedside table to waist level, because this is the sterile field. Anything down below this is breaking sterile field, so everything needs to be right at waist level. I'm going to pull down your covers, and then you're able to bend your knees. So with the mannequins, you're going to bend the leg up. Take your time doing this. Once you get it like this, take the knees and push them out a little bit. Sometimes they're out, sometimes they're not, and you can kind of adjust it. You want to adjust it so that her bottom is a little bit up off the bed. Okay, that's going to make it a little bit easier for you to position her. Okay. All right, so I'm going to pull back your gown now. I'm going to inspect your genital area. I'm going to do some light touching. So I'm going to look at the urethra. The top hole is the urethra. The middle hole is the vagina, and the bottom hole is the anus, okay? Sometimes it happens when you're putting in a Foley catheter that you get it into the wrong opening. It is okay because women do not look like this, okay? And so if that does happen to you in real life and you put it in, normally what will happen, like you'll get it in, like you'll think everything's fine, and then it'll hit the top of the cervix, curl around and start to come back out. Just leave it there, don't pull it out. Have somebody bring you a new kit and just start again and leave it there as a guide mark of where not to go next time and aim a little bit higher, okay? All right. So for the sake of you guys being able to see, I'm gonna lower her knee down, okay? All right, so I have inspected the area. I know where I'm going to go. I'm gonna go ahead and take off my gloves, put them in the trash can that's right here, hand sanitize. Again, I'm gonna start to get everything ready. So I'm gonna open my Foley kit. If you notice on the Foley kit, right here it tells you the size, 14 French, 5 cc, the size of the Foley. This is important for your documentation. So 14 French is the size. We measure the size of the circumference in Frenches. I don't know why. So it's like a gauge on a needle. So only it's opposite. So the smaller the French, the skinnier the needle. So it's the skinnier the catheter. So it's opposite of needles. So that you don't have to remember what size you have. You can just set the paper right there and you can take it with you when you leave. So you don't have to worry about what size Foley you put in, okay? Next, I'm going to open and I'm gonna set my catheter kit with this far end even with the mannequin's heel. That gives you enough room to be able to maneuver all the stuff. And then I'm gonna take the bag and I'm gonna make a little trash can with it at the edge of the bag. You can also bring a trash can close to you. The problem with the trash can is that for the last 30 years, you have been dropping trash down here. This is breaking sterile technique once you have the sterile gloves on. So don't be tempted to drop stuff in the trash can because you have to drop it from waist height. The trash can's right here. It's a lot easier to drop it and not have that problem, okay? So the first thing that you wanna do is you want to open the package and you're gonna set it so that you open it away from you. And this is something else. You can start a Foley catheter from any side of the bed, but as you're standing the same direction as your patient, you wanna do it, you wanna stand on the side where your dominant hand is. That way you're advancing the Foley with your dominant hand. You can do it from the other side. I've done it from the other side. It's just a little bit harder to do. So it's best to stand. So if you're left-handed, stand on that side, right-handed, stand on this side, okay? So when you open it, the number one mistake on this part that students make is they open it like this. See how my arm is directly over now my sterile field? I have just broken sterile field because I have my dirty arm over the sterile field. When you open it, you want to open it to the side. Okay, does everybody see the difference in that? Okay. Then whichever flap is on top, you're gonna open the next one. I forgot, I actually need to, I'm gonna go ahead and expose her now. Since I've touched her again, I'm gonna re-hand sanitize. Okay, so I'm gonna pull this down. When you open your Foley kit for the first time, most likely as soon as you open this is gonna pop back up because it's been folded. Don't take your other hand and reach over the sterile field to hold it down. That's the second problem. Open it kind of slowly, see what happens, come around on this side and make sure that everything stays flat. You can touch the outside and then within a 1-inch border of the inside and not break the sterile field, okay? So I have that open. I'm gonna open this one toward the patient. And then the last one, I'm going to open away from me. You can be wearing gloves during this part. You do not have to wear gloves during this particular part. On top are your sterile gloves that come with the kit. They're not the greatest sterile gloves. You're gonna pick them up, not touching anything else, and you're gonna set them over here in case you need them. Okay, and that's like if your other ones happen to rip. Then you have a white drape on here. This one is small and I have no use for it, so you're gonna pick it up and put it over here outside the sterile field, okay? The next one is the blue drape. This is the one that you're gonna put underneath the patient's bottom. So when you pick it up, you need to only touch within the 1/2 inch margin. You're going to lift it up, making sure that it doesn't touch anything that's not within the sterile field. And you need to look to see which side is the shiny side and which side is the dull side. The shiny side needs to go down. So you have to maneuver it in such a way that you have it so the shiny side is down. My elbow is over here, but this area where my elbow is isn't sterile. You see it's over the patient, not over the sterile field. The bottom part of this is sterile. So you're gonna stand at the knees of the person like a bullfighter, and you are going to take it, and so you can touch all that stuff that's sterile in there, and you're going to drop it at their legs, and you're not gonna pull your arms out this way, you're gonna pull your arms up and out, okay? Now when both the legs are up, it's gonna be a lot easier to adjust it. You can come on the bottom side and pull it down a little bit because you're only touching that 1/2 inch area, and I'm gonna pretend like her leg was up so that this felt better. Okay, and if you need to come around, walk around to the other side, that's fine. But now that you have everything open, you can't walk around like this. I'm putting my back to the sterile field, and now I'm not gonna see the mouse that runs across it and makes it unsterile. So you can never turn your back on the sterile field once it's open. If you need to go around to the other side of the bed, you have to walk like this, keeping your eyes on the sterile field at all times, okay? That information is gonna become extremely important when we go to put on our sterile gloves. All right, this next thing is called the fenestrated drape. I don't use it. It causes more problems than what it is worth. I'll show you what it looks like though. So and you would never open it like this, but I'm just showing you what it looks like. It looks like this. If you're using it for a male, you put it over his penis and it kind of gives you like a little extra sterile area. For a female, it goes over this area. You do it the same way. You do the whole, the whole bullseye thing and put it on. You can do it either direction. That one's probably best. The problem is now that this is touching the patient, it's no longer sterile. So when you come with your Foley catheter, students are always hitting the paper and breaking sterile field. Like, it's more trouble. Like, I understand the idea behind it, but I feel like it's more trouble than it's worth. On the step-by-step, it says that it's optional. So I just pick it up and put it to the side. So now that I have off all that stuff that I'm not gonna use, there's actually one more thing I'm not gonna use, but I'm not gonna touch anything else. Now I'm gonna don my sterile gloves. So I'm gonna hand hygiene again. And again, not putting my back toward the sterile field. I'm going to open my gloves, and I haven't gotten sterile yet, so I can drop that lower. And this is kind of funky with the drape. So we're gonna be in the other room. You're not gonna have the drape, so you won't have to worry about having the drape, okay? So you need to open your gloves in such a way, because now the gloves are also a sterile field too, right? So you have to be able to see both sterile fields at the same time. And these are the crummy gloves that I grabbed. And so remember how they stuck and everything? But open them slowly so you don't accidentally break sterile field. All right, so quick reminder, you're gonna stand in front of the dominant hand so you're not reaching across the sterile field again to pick up gloves. I'm gonna hold this down here. You can pick it up at the cuff. Okay, and then you're gonna take a step back so that you don't touch anything to it with the fingers. Again, take your time getting on the glove. It's not a race. Remember, you can only touch the cuff. Okay, so I have that one on. This one, you can hold it. Remember, if it's stuck, you can pick it up, turn it sideways. You're gonna get your fingers in. Remember, the thumb we're hitchhiking is the gloved hand, not this hand. Don't try to put it like this, it won't work, okay? Take a step back, hitchhike the thumb. Meanwhile, I can still see my sterile field. Okay. Okay, so now everything has to be up here in a sterile. I don't need that anymore, so I can turn my back to it. So hydrogen peroxide's on top. You don't need hydrogen peroxide. Your patient's not allergic to betadine, and I don't like the idea of putting hydrogen peroxide on mucous membranes if I don't have to. I'm gonna bring it straight out of the sterile field, around, and drop it, okay? And next, I'm going to open up my povidone iodine. I'm not really gonna open it up because we don't wanna dye the mannequin, so open it up. I'm going to squirt it on my cotton balls that I have here. Then when I'm done, I'm gonna set it upright, pull it out, and drop it. If something drops and it doesn't make the trash can, you'll pick it up later, okay? Next, I'm going to open up my lube. You can actually use the lube with the mannequins, that's not a problem. You don't have to. If you do use the lube, we do have more lube in the drawers. You don't need tons. You don't even necessarily need this entire package for the mannequin, okay? Make sure that you properly clean your practice Foley catheter. Otherwise, it's gonna be hard to get it back in its packaging, and I'll show you what I mean here in just a minute, okay? So there is like a little paper here that is for the lab test that we're not doing, so you can pull this out and drop it. So I'm gonna squirt the lube. Just I'm gonna show you, I'm squirting it in here, okay? Squirting the lube in there. Pull this out and around. Okay, so now I have that part done. I'm going to take the tray. Now I don't wanna, I'm gonna pick up the tray and I'm gonna scoot it forward. I don't wanna scoot it forward like this because now I've broken sterile technique again, okay? My arm over. I'm gonna pick it up on this side and move it forward like that, okay? Pull my hands up and out. Now I'm gonna look at everything in the bottom part of the tray. I'm gonna pick up, since we don't need the specimen container, pull it out of the sterile field and drop it. I'm going to look at my Foley catheter. I'm going to pick it up and I'm going to make sure that it is closed. It says closed right here, but it could come and it could be open. So if yours happens to be open, you always want to check and make sure it's actually closed before you insert it. Okay, and then the next thing you're gonna do is you're gonna take the sheath off of it, and this is the part that's hard to get back on if there's a bunch of lube on it, okay? So as you take this off, you want to wrap the end of the catheter around your hand because you don't want it to hit the patient's leg and break sterile field, okay? So you're gonna get that on there. This is the thing that is the worst at making the trash can, and you just leave it there, okay? So I'm going to take this, I'm going to put it in the lube, not reaching over the sterile field. I'm gonna put this in the lube, and then I'm gonna set this back in the box. And then I'm going to take my flush, and you can see I've used this a couple of times. I'm gonna go ahead and attach it. So I'm gonna take the lid off, drop it, and I'm gonna go ahead and attach it. I'm just gonna hold this up for you guys. I'm gonna attach it right here. This is the inflation cuff, so you're just gonna put it on. This is a lure slip, so you're just gonna set it on there, okay? And you can attach the the flush before you do the lube. You can do it after you do the lube. That part, it doesn't necessarily matter. As long as you have everything set up and you're not reaching over the sterile field, you're okay. All right, now you're gonna tell Ms. Green here, all right, Ms. Green, I'm getting ready to clean you. You're gonna feel a cool wetness on your genitals. I'm gonna touch you. I'm gonna clean you with 3 different cotton balls. Are you ready? Yes. Okay, so here I'm gonna touch you and I'm gonna spread your labia. So what you wanna do, you're gonna clean with 3 cotton balls. The first one, you're gonna clean furthest away between the labia majora and the labia minora, right here, from the front to the back, like you would normally wipe. The second one, you're gonna clean closest to you, again, between the majora and the minora, right here. The third one, you're gonna clean in the center, okay? For the purposes of the checkoff, because it's not wet and this is plastic, if you actually try to rub this cotton ball against the plastic, you're gonna lose the cotton ball, okay? And you don't want the plastic part to touch her. So what you're gonna do is you're just gonna like lightly do it along her. You can touch like with the edge of the cotton ball, but don't do it like you're actually how you would do it if you were cleaning somebody, okay? So, all right, so I'm gonna touch you now. So you're gonna take your non-dominant hand and spread everything open. And when you reach, don't reach over, okay, the sterile field, I'm gonna come down and clean. I'm gonna pull this up and out. I don't wanna take it this direction. I'm dripping bacteria all over the wrong thing. Up and around and out of the sterile field and drop. Come back in from the side again. Don't come back in this way. The one closest to me, up, out, and around. In the center, up, out, and around. All right, you still doing okay? I no longer need this. I can drop that. Yes, I'm doing fine. All right, so I'm gonna get ready. I'm gonna go ahead and advance this. This is still sterile on the bottom. I'm gonna set it over the top so that everything is nice and close, but not too close. I'm gonna go ahead and insert the catheter on the count of 3, and I want you to bear down like you're going to urinate. So we're gonna open up. This is the next area where students make a mistake. They hit their finger when they go in. You cannot touch any part of your glove as you are entering, or else that is a break in sterile field, okay? You also need to be careful that this doesn't flop out and touch the patient prior to getting this in. It can touch the drape because the drape is sterile, but it can't touch the patient, okay? So we're gonna, when you first start to go in the mannequin, go in a little slow and kind of turn it around a little bit. Once you get past the first little bit, you're okay, and it'll slide in super easy. The important thing is when you go in, that you don't go in all the way and then touch your sterile hand to the labia. So you have to push in just a little bit without touching. In order for me to tell whether or not you're touching, girl, I'm right up here in the business too. So I am gonna be standing very close during this checkoff, okay? You're going to continue to feed it in, working your hand backwards. And like I said, once you get to a certain point, it's gonna be really easy. Once it gets to that point and you're about halfway and have about this much left, you're gonna say, I see clear yellow urine filling the bag. At that point, the sterile part is over and you can take a breath. Okay. Now what we're gonna do is we're going to inflate. I'm gonna inflate the balloon that helps keep it in your bladder. Just let me know if you have any pain. You're gonna start to inflate it. When you inflate it, it's gonna inflate the balloon. You have to hold pressure, so watch my syringe here. See what happens when I let go, how it fills back up? You have to hold the pressure on it when you let it go. It's okay if water drips out. Remember, the sterile part is now over. So that you practice, if you want to pull this out and around so you don't forget, you can totally do that, okay? So then what you're gonna do is, I'm gonna show you on the mannequin like what this looks like. So you're gonna pull back gently with your sterile hand again until the balloon sits at the bottom part of the bladder. For this, it's going to come like way out. On a regular person, there's not going to be so much on here. So you can just pull it out a little bit if you want to and say, all right, I've gently pulled on the catheter and it's now resting at the mouth of the bladder. Okay.
We didn't have to check the balloon prior to putting it in?
No. The more times you blow it up, the bigger chance that that it's not going to inflate well, or that it's going to hurt more when it actually goes in the person. So now what you're going to do is you're going to take off your sterile gloves, and your hands are going to be super sweaty after doing that. But remember, this is part of 2 checkoffs for your sterile gloves, so don't mess it up, okay? You're going to lose a lot of points on that. Perform hand hygiene. Going to put on another pair of clean gloves. All right, so here's some important information I'm going to do and teach at the same time. Okay. So if you need to get out of bed, you need to give us a call. I'm going to affix this to your leg, and then it's going to hang on the side of the bed on a non-moving part of the bed. But I still want you to call the first couple times because it can be kind of difficult. You're going to take like a 6-inch piece of tape or so, put it on the mannequin to maneuver the first time. But when you do get out of bed, you want to make sure that you keep the bag below the level of your waist. Don't let the tubing or the bag touch the floor. And you're in PO right now for your surgery, but once you get out of surgery and you're able to start to have fluids, I want you to be drinking 2 to 3 liters of water a day to help prevent a urinary tract infection. All right, when you tape this to the patient's leg, you want to make sure that this access hub, this is like for pulling a specimen from the Foley, is facing to the side. You don't want it on their leg or else they can get a pressure injury from it. You're going to take your tape, and you've made 2 little pull tabs on either side. And again, since it's a mannequin, it's not going to be exactly perfect. I don't know why the tape on tape is not working. So we're going to, if you need to add extra tape, you can add extra tape, okay? All right, so I'm gonna go ahead and take the rest of this out. When you're practicing, pay attention to how things are positioned, or you may wanna tape yourself like you people do on Instagram on the unboxing, so you know what order to put stuff back in and how it looks and what orientation it is, okay? All right, so I'm gonna go ahead and put her leg down. Pull this down, cover her up. And do you have any questions about the education that I gave you? No? Okay, great. You can attach this to the sheet if you want to. You don't necessarily have to. All these beds have a hook right over here on the side where you're going to hang it. All right, how am I doing, Gianna?
Good.
Am I doing okay still? Okay. I'll pick up the rest of my trash. Again, I'm putting my kit back together, so I don't want to make a mess. I guess technically I don't have to this time because this will be the last time I have to demonstrate it. I'm going to go ahead and get her covered up. I'm going to be back in about 20-30 minutes. Oh, you know what? I should ask you, did you have any discomfort with the procedure? Yeah, the pain. I had pain. Can you rate it on a scale of 0 to 10? It was a 3. Okay, I'm so sorry, but we know that you need to have this Foley. I'm going to lower your bed, put your call light right here. If you need me, I'm the big red button, but again, I'll be back in about half an hour or 2, and I'm going to take a look at everything. And do you have any questions for me? No. Okay. My gloves. Can't sanitize. I'm going to have all my stuff on the trash, and then I'm going to leave the room. when you're first looking, the one thing I forgot to say, when you're first looking at the genital area, you want to note if there's any, on a female, like any prolapses, if there's any visible obstructions or strictures, things like that, that may make it difficult for a male. You want to look at where the opening to his urethra is. He may have hypospadis where it's on the side or on the bottom instead of at the tip. So that's something that you would want to note in your narrative notes, and information that you would give when you're giving handoff to somebody. If they are uncircumcised, you would retract the foreskin, and then, and this part would be the same for circumcised or uncircumcised, you would pull back on the glands a little bit and tell them to bear down as you put it in. The male urethra is really long, so like you're gonna be putting in almost all of it to get into the bladder when you do that. And then you always need to put the foreskin back down, pull it back down over the edge when you're done. Otherwise, you can cut off blood flow to the penis, and nobody wants that. So, let's see here. What other things? Am I missing anything, Gianna?
Yeah, it says, well, you didn't miss it, but it says to ask for the pain, like you come back into the room and ask pain.
So yeah, so when we come back, you'll come back in and say, are you still having any pain? I'm gonna look at the insertion site, make sure that everything still looks okay, and you're just gonna verbalize this part. And I'm gonna note that there's 250 mils of urine in the bag. Anything else that I missed on?
No. Is the catheter patency